Hello, beautiful people. Welcome back to Ruth Tells, where we share real stories, real experiences, and real lessons from real life. Today's story is a serious one, and it's about something that is affecting many Black women around the world, especially when it comes to pregnancy, labor, and medical care. Recently, videos have been going viral online showing Black pregnant women in serious pain, but instead of receiving fast and compassionate care, they were questioned slowly, ignored, dismissed, or even sent away. In both of the stories I'm about to share, the women were clearly in labor, yet they did not receive the same level of urgency and attention that every woman deserves. A pregnant Black woman at Dallas Regional in Mesquite, Texas, was in active labor and clearly in pain. A nurse, who appeared to be a white woman, did not react with urgency. She asked long questions slowly, without eye contact, while the woman begged for help. At one point, the pregnant woman even asked, "Do you treat all patients like this or just the Black ones?" The situation became so uncomfortable that the person recording stepped in, reminding viewers that Black women are statistically more likely to die during childbirth due to pain being ignored or misjudged.
Y'all treat all your patients like this or just the Black ones?
Last name is Jones. She's G3P2. I'm not sure what her due date is.
Her due date
I
is
just said it was the 10th.
Her due date is the 10th.
She had 3 pregnancies, 2 babies at home. I bet y'all listen next time. When you found out you was delivering at this hospital, your ass should have changed doctors.
Thank you.
Everybody say how they treat people.
Another woman escorted out during labor. A different Black woman was reportedly sent out of a hospital even though she was in labor. While she was leaving the hospital on her way to find help somewhere else, she gave birth in a car just minutes after being discharged. This happened so fast that it left many people questioning, how was she not recognized as being in active labor before leaving? These stories are not just random, they are part of a bigger issue that many Black women have been shouting about for years. Not being believed, not being taken seriously, not being treated with urgency. Studies have shown that some medical workers underestimate Black women's pain or assume they can tolerate more discomfort. That mindset is dangerous. This story touches my heart personally because I have gone through labor myself and I remember the pain very well. When I was giving birth, I was induced because my baby was already past 40 weeks. I was in serious pain all through the night, and even when I cried out, nobody came quickly. I later noticed that there were 2 older white women in the same room, and the nurses responded to them faster than they responded to me. At the time, I didn't even think deeply about it because I was focused on the pain. Sometimes when you are suffering, you don't see the full picture until later. I also grew up in Nigeria, and I have seen even worse behavior from some nurses back home, especially when it comes to ignoring patients, being rude, or not showing care. So in my mind, I just assumed nursing everywhere was like that. But after I delivered my son and later started working inside a hospital myself, that was when my eyes fully opened. I could now clearly see the differences, the patterns, and the changes in attitude. I also learned that when you are trained as a nurse or a healthcare worker, you are taught to care for every patient equally, no matter their race, skin color, background, or personality. But sadly, not everyone practices that in real life. Some nurses are amazing, loving, and dedicated. I will never ignore that. But there are also others who carry personal bias, frustration, or discrimination into their work. And that is dangerous because they are dealing with human lives. If someone cannot treat patients with respect, empathy, and urgency, then I believe there should be serious consequences, including suspending or removing licenses. Hospitals also need better monitoring, supervision, and investigation systems. If multiple patients complain about the same nurse, it should not be ignored. It should be properly investigated, because ignoring complaints can cost lives. Healthcare is not just a job, it is a responsibility, and people in pain deserve care, not judgment. Let me be clear, this is not about saying all white nurses are bad or all hospitals are racist. Many nurses are angels, heroes, and lifesavers. This conversation is about the system and the pattern that keeps showing up and the lives that are being risked. If you are a Black woman, pregnant or planning to be, please speak up, ask questions, bring an advocate, and trust your body. If you work in healthcare, please listen when a patient says they are in pain. And if you have a similar experience, positive or negative, I invite you to share your story in the comments, because stories save lives. Thank you for watching Ruth Tells. Don't forget to like, subscribe, and share this video so more people can learn and stay safe. See you in the next story. Stay blessed, stay aware, and stay loud.